I'm Melissa Sixberry, the Director of Disease Control for the Yakima Health District. I'm just going to give a little bit of information about how we pull our data for hospitalizations, as well as the metrics that the State Department of Health is going by, and a little update on our death reconciliation. So the 3 hospitals in Yakima County and all counties, hospitals in all counties in the state of Washington, report to a system called Rapid Health Information Network, also known as RHINO. When a patient is admitted to a hospital, that information gets sent to RHINO. That information loops into our Washington disease reporting system. And if somebody's had a COVID test that has been positive and has had a hospitalization, they get linked together for a COVID hospitalization. So our role at the local health jurisdiction is to determine whether or not that was actually a COVID-related hospitalization, or if they were hospitalized for some other cause, such as somebody in a motor vehicle accident wouldn't be hospitalized for COVID, even if they were COVID positive, if they weren't having symptoms of COVID or needing treatment for specific for that. So that's why when you look at the numbers of our hospitalizations, they can kind of go up and down. That's based on when we reconcile all those hospitalizations to ensure that they actually are COVID related. The metrics that the State Department of Health uses is they pick a time frame because there is a lag from the time that the information from the hospitals get reported to the RHINO into the WDRS system. There can be up to an 11-day lag, and so they go 11 days back on that, as well as the cases for per 100,000. There's typically an 8-day lag for full information or complete information for our case counts. So they go back 8 days on those and then go back 14 days prior to that. And that's how they pick their dates. So for this last metric that was ruled out for today was from April 16th through the 21st of April, or excuse me, the 15th through the 21st of April for our hospitalizations over a 7-day period. So we look at those daily. They will fluctuate, and again, that's based on as new cases are put in to be hospitalizations. We reconcile with the hospitalizations for the hospitals to confirm that that actually was COVID related. And then also on our death reconciliation, it's been noted on our webpage the last few days that we're not updating deaths because we're currently reconciling. The Department of Health has specific guidelines on what they classify as a COVID-related, classify some of these. Some of them are classified by Department of Health as a suspect related COVID death, meaning that they didn't necessarily have any symptoms of COVID, but they did have a positive test within a certain time frame of their death. So that's all stuff that we're going through to make sure that DOH has the most accurate information from us, and if we feel strongly that those were not COVID related, that we can have Department of Health update theirs. We're trying to get our best to match as closely as we can to the Department of Health and aligning with what their classifications are.